Hi, my name is Destiny. Today I'm going to demonstrate how to administer medication via CIVA. So I've compared my MAR to my doctor's order and ensured that everything was transcribed accurately. I then brought my MAR to the Pyxis machine and I got my correct medication as well as gathered all my supplies. So I'm going to just begin by performing my first medication check by comparing the MAR to the medication vial. So I have the correct patient, Emma Wrightson. They have an allergy to morphine. The correct medication, Lasix or furosemide. I have 40 milligrams, which I can get accurately from this vial, IV, and it's given once at this time, which is right now. I'm going to look at my parenteral drug monograph here. I see it is a diuretic, the class of diuretic or antihypertensive. This is appropriate for my patient because they have high blood pressure. It can be given by a nurse or a student nurse, and the dose that the doctor prescribed is within the safe range. As noted on the parenteral drug monograph, it's applied as 10 milligrams per milliliter. And since I'm giving it via CIVA, I'm going to go to my CIVA chart, and I see here that a 40 milligram vial is to be given 5 milliliters in a 10 milliliter syringe on the pump setting of normal and administered over 13 minutes. I also note some potential hazards, and these are things I would let the patient know of, or side effects that they may expect. Things such as dizziness, headache, restlessness, loss of appetite, nausea, etc. So I'm just going to close this up, and I'm going to begin by preparing my medication here. So my drug calculations, I've determined that I need to draw 4 milliliters up of medication with an additional 1 milliliter of normal saline in order to get that 5 milliliter in a 10 milliliter syringe.
You had already said you know what you were looking for, so if you had a reaction.
I'm going to swab my vial for 30 seconds and let dry for 15. And I'm choosing to dilute the medication in normal saline because my patient has no additional need for calories, and it is compatible with my primary solution. So now that my vial has dried, I'm preparing my syringe here. So I'm going to inject 4 milliliters of air.
I'm just going to go over my MAR. So,
wait, we need to stop this. Actually,
it's our second time doing it, so I just stop my rate.
Okay, so we're going to draw up 4 milliliters here.
That's okay. I just don't really know what to do about mine. Like, my numbers.
just put maybe 0.
I'm going to remove any air bubbles to ensure that I do have the correct dosage and volume of medication. So I have here my 4 milliliters. I'm going to use the scoop method to cap my needle to maintain its sterility and prevent any needle stick injuries. So I have here 4 milliliters of medication of furosemide. At this point, I'm going to do my second medication check, comparing my MAR to my vial to my medication that I've prepared. So I see here that I have the right patient, Emma Wrightson. She has an allergy to morphine. I have the correct medication, Lasix or furosemide. The correct dosage, 40 milligrams. And since this concentration is 10 milligrams per milliliter, I have to draw up 4 milliliters in order to get 40 milligrams. IV, and it's being given once at this time right now. So I've done my first medication check. At this point, I am going to dilute my medication in my CIVA syringe. So I've determined that I'm using normal saline as mentioned before, and I need just an additional 1 milliliter. So I'm going to swab my vial for 30 seconds and let dry for 15. It is also important that as I've ensured that this normal saline is not expired, as well as my furosemide medication, it's not expired. We want to check this because if a medication is expired, it can decrease or increase the potency of the medication.
Maximum control dose is 500 milligrams, and I'm giving 400 milligrams, so I can give it.
Okay, so I have here
500 milligrams. That is good. I just supply it at 500
my 10 milliliter syringe. So this is what I'll be using to administer the CIVA. So I'm going to inject 1 milliliter of air and draw up 1 milliliter of normal
Final
saline.
concentration is 100 milligrams per milliliter. I will then further be diluting in 250 milliliters a day.
I'm going to drop 1 milliliter here. Get rid of any air bubbles once again.
The battery that's making. Most of my patients doesn't really need any nutrients or anything. And I go 250 instead of 500 because my patient doesn't need
Just recap this again. Be careful to maintain its sterility. Now at this point, I'm going to inject my medication into my syringe. So I'm going to pull back the plunger. I would remove this needle and discard this in the sharp spin.
Also, the potential hazards that I would be looking for are nausea, vomiting, diarrhea,
And draw
abdominal pain. So I will
take this off.
for that before and after.
Actually, sorry, I need to pull this back quite a bit more.
So I have my vials here. I'm just going to swab them for 30 seconds. And then guard 15. For the purpose of this video is 30
But
seconds.
again, recap this using the scoop method. And this would be discarded in the sharp spin as well. So I'm going to get rid of any air bubbles in here. And I should have 5 milliliters by the end of it. So it's gonna
So I will be needing 4.8 milliliters of sterile water for my injection. So I will need 4.8 milliliters.
And at this point, since I am bringing this to the bedside, I'm just going to recap this with these little blue caps here.
Okay.
Be careful to not touch either tip of the syringe or this cap to maintain its sterility and prevent any introduction of microorganisms to my patient's injection site. So now that I've prepared my medication, I have a label here, and I'm going to attach this label to the syringe.
Get the bubbles out just to make sure that I do have the correct amount of sterile water in here.
Being careful not to cover any important information. Okay. So at this point, I am ready to go to the patient's bedside. I have my medication and all my needed supplies.
4.8 milliliters of sterile water.
As I enter the patient's room, I'm performing hand hygiene and I'm doing a general safety check. There's no tubes or drains lying around. The patients have no visible distress.
It is still clean
And the side rails would be up. And I'm going to inspect my primary bag here. Primary bag's good, the tubing is intact, and it's running at the correct rate. I'm going to introduce myself. Hi, my name's Destiny, and I'll be your student nurse today. I'm going to give you your Lasix for your hypertension. Some things just to watch out for with this medication, things like dizziness, hypertension, nausea. If you experience any of these, if you could let me know, that would be wonderful. I'm going to ensure that it is the correct patient by comparing my MAR to the wristband. Now, I'm right then. And can you please tell me your name and your birth date?
I'm going to get 4 ml of air.
Sounds great. And while I'm here, I'm going to inspect his, their IV site. I see here there's no signs of redness, swelling, or pain at the site. Therefore, it's not indicating any phlebitis or infiltration being present. So I'm going to do my third medication check before I prepare my medication. So I am comparing my syringe to my MAR. Okay, so I have here that it is the correct patient, which I've identified. Amorexin, allergen to morphine,
Make sure of the correct dose.
Lasix, correct drugs, furosemide, 40 milligrams, which I have in here, 40 milligrams, given IV, and given now, the correct times. So I've done my medication check.
My second check with my vial. So my right
I'm going to begin by preparing my medication. And so,
right now, 400 milligrams, 4 ml, which is in my syringe.
I have my tubing here, my micro tubing.
Right route is IV, this is given IV, and the right time is daily, or 0900 inches down.
So I will.
So now I can further dilute my medication into my tubing that I have chosen here.
I'm going to
This is not
my
expired.
cap off here.
Integrity is good, so I can use it. So I'm just going to swab the end of it for 30 seconds and let it dry for 15.
Be careful again not to touch the tips to maintain its sterility. At this point, I'm going to make sure my clamp is open, which it is. I'm going to hold this, again being careful not to touch either or, and I'm going to forward prime my medication. So I'm just watching for a little blend at the
Now
end
I'm
of this.
just going to gently roll this just to make sure that everything, the medication disperses.
Okay.
And I'm going to put my label that I
There's my
previously made over top, not covering any
Again, be
important
careful not to
information.
touch.
So my label has the patient's name, it has the drug on it. There's a zipper mount.
So I've primed my tubing. This just ensures that all the air is out of the tubing, so we're not going to instill any air into the patient, which would not be good. So I'm going to the bedside, like I did. I'm going to begin by connecting my CIVA to their IV site. So I'm just going to close my clamp here, just in case I do accidentally press the syringe, that they don't get the medication at the incorrect rate. I've known that the patient has the right to refuse, but has not done so, so I am proceeding.
Patients in no distress or
I'm
anything.
going to swab this for 30 seconds and let dry for 15.
I'm calling out your student today. Can you tell me your name and your birth date? Okay, and you have an allergy. So
I'm just going to use your bed here to lift your syringe. It's dry and I'm being careful not to touch.
Okay, so I'm just going to go do my third check now. So right patient and we're raising. So chapter already.
And I'm going to put my medication into my CIVA pump.
Right route is IV. This is a urine IV. And break time is daily. So right now, I can give it.
So as the CIVA chart did say, the top of the plunger is at that 15-minute mark, which is the correct time that it is to be administered. At this point, I will ensure that my clamp is open, and I will start normal because it's supposed to be on the normal setting.
Looks good. Okay, this is right then.
So my medication's running. I'm going to continue to monitor my patient. I would document on the mark that I've given the medication. Okay. And I'm going to stay with my patient just to observe for any signs or immediate signs of allergic reaction or just
Lower my primary day.
any signs or symptoms that the medication is not going very well for them. And just to ensure that the plunger is being depressed. And I'm going to continue to monitor my patient for adverse effects, and as I've let them know before, I could remind them of those adverse effects, and if they do experience any of them, to let me know. And I will continue to monitor for improvement of my patient's symptoms by looking at their lab values, doing vital signs. I would do vital signs before I give this medication as well as after this medication. And I have my label here for my tubing. So it has my initials, date, and time. So I'm going to label my...
Okay guys, we have about 14 minutes left.
This ensures that any nurse just knows that this is when this tubing was hung. When I come back, so after 15 minutes, when this is done, I'm going to come back with a 3 milliliter normal saline syringe, and I'm going to connect it to the tubing and allow it to run at the same rate, which is normal. This ensures that all the medication in the line enters the patient so they get the correct dosage of medication and hopefully the full effects of that medication.
And label onto my tubing.
So I've documented, I've ensured that my patient's in a comfortable position, the call bell is in reach, and as I exit the room, I would do an exit safety check.